The president, he was in the heartland yesterday telling Americans that action needs to be taken now in order to fix the health care system. Critics who believe that reform is too expensive, they have yet to be buying in on the big idea here. Insurance broker Craig Gussin is here this morning to talk about it. And I think what we're going to do, Craig, is we're going to listen to a couple sound bites from the president first, and then we'll bounce off what exactly he said. Let's start with the sound bite here this morning.
Dollars we earn on healthcare. And in 30 years, we'll be spending $1 out of every $3 we earn on healthcare. And that's untenable. It's unacceptable. I will not allow it as President of the United States. We also have to provide Americans who can't afford health insurance more affordable options. That's an economic imperative, but it's also a moral imperative. Because we know that when somebody doesn't have health insurance, they're forced to get treatment at the ER, and all of us end up paying for it. Now, I know that there are millions of Americans who are happy, who are content with their health care coverage. They like their plan, they value their relationship with their doctor. And no matter how we reform health care, I intend to keep this promise. If you like your doctor, you'll be able to keep your doctor. If you like your health care plan, you'll be able to keep your health care plan.
All right, Craig Gussin is joining us here this morning. He is an insurance broker, and lots of people, of course, are reacting to the president's speech yesterday. Good morning to you.
Good morning.
First of all, general reaction to the overall plan.
Oh, I thought, he did what he's supposed to do. He's trying to promote, changing health care. He has his, what he wants to get done this year, and I think he's trying to get it done this year, and he wants to do, in my opinion, the same thing you did with the stimulus bill, just get it passed.
Yeah.
But we're not hearing a lot of how are we going to pay for this. You can't keep printing money because there is not money. Your kids, my kids, our grandkids are going to keep paying between the stimulus bill and the health care that he talked about. So that's one of the concerns I have.
One of his selling points, as we just heard there a moment ago, was the fact that apparently Americans spend $1 out of every $5 right now on health insurance or coverage in some kind. And he says if we let this go, it's going to be $1 in $3 that we're spending on this. Do you believe it, number one? And number two, is there any truth to this?
There is. The cost of health insurance has gone up. There is. But the reason is, what she doesn't talk about, is we have more medical opportunities to live longer. People are living longer because of the newest equipment we have, the newest pills. Look at advertising. Every third advertisement is a prescription, the newest ones on the market that make you live longer. And that's why some of the cost of health care. The other is, America probably income is higher than most other countries. So we're going to spend more on health care to protect our bodies and live longer than other countries will. But yes, the cost of health care has gone up.
Okay, so under this plan, basically he is saying that private insurance, if you have private insurance, you can keep that.
Correct.
You can go ahead and keep that, but there will be what they're calling an option, a federal health care option where you could actually buy into it.
Right.
He claims there are 50 million people out there that are uninsured. You have a bit of a problem with that number.
Yeah, the numbers I see are 47 million. And of the 47 million, 16 are children who actually qualify for subsidies through healthy families.
Yeah.
Another 16 million are family incomes of 50,000 or more who just choose not to buy health insurance. Another 9 million of that is kids 25 to 32 who say, I'd rather pay for my iPhone, I'd rather pay for my computer, and I'd rather pay for spending nice weekends than spending $80 to $100 a month and have health insurance.
So just a matter of priorities for that particular group. Talk about very quickly this the family program, the Healthy Families program, because that here in California actually can help a lot of people get insured for very cheap.
Yeah, it's like $46 a month. The best example I give, if you're a family of four, husband and wife, 2 children, and you make less than $5,300 a month, your kids will qualify for Healthy Families. It costs between $4 to $6 a month, and it will pretty much cover all the expenses.
Now, is he sort of talking about this on a national level? Is that how you say that?
It's already national. It's called S-CHIP all around the country. And in California, 1/3 of all the uninsured are kids. And they're already actually covered if the parents would sign them up for Healthy Families.
So there are some things you like about this, and there are some things you just don't like about this.
Right, because he wants to cover He wants to insure people who are actually already insured. They just haven't signed up for it.
Right. All right, Craig, are you going to fight this thing, or are you one of the ones on the other side of the battle?
You know what? We do need health care reform, but we need to do it in the right way, and we need to realize everybody's talking about health care reform, but the president and Congress never says, what do you mean by health care? Is it the health insurance premiums? Is it the hospital costs? Is it the doctor costs? What is the cost? They just throw it all out there because it sounds great. Yeah. But there's no definition of what is the exact problem. And I think there's a lot of ways to fix the system.
It's a very complicated system.
It is a very complicated system, but you can't rush it through because the consumer and the American people are going to end up paying dearly. And the government plan sounds great on paper, but if they go and do some of the things they're talking about doing, then what's going to end up happening is the public plan will end up costing a lot more money than the individual plans. And how do we know that? Because every time the government gets involved in any type of plans, what happens? It ends up costing a lot more money because they can't do it as efficiently as we can in private business in the United States.
Just thinking of a $600 coffee pot right here. I don't know.
Okay.
You know what I'm saying? Craig, thank you so much.
My pleasure.
Have a good one.
Thanks.
See you later.